This is the heart model. The heart is located deep to the mediastinum between the fifth and sixth rib. The coverings of the heart are the parietal pericardium, which covers the cavity, the cardiac cavity, and the visceral pericardium, which is on the heart itself. The layers of the heart are the endocardium on the outside, the myocardium in the middle, and the epicardium. Both the epicardium and the endocardium are made of simple squamous epithelium. And the myocardium is made of cardiac muscle. Structures of the heart. This is the left atrium, and back here is the right atrium, which has the fossa ovalis located in it. This is the right ventricle, and this is the left ventricle. These are auricles on both sides, which have pectinate muscles located here. This right here is the interventricular septum. Here are the chordae tendineae located on the tricuspid and mitral valve, the finger-like projections here, and they are attached to the papillary muscles. This is the tricuspid valve, which has 3 flaps, and the bicuspid valve, or mitral valve back here, which has 2 flaps. This is the pulmonary semilunar valve, and the aortic semilunar valve is back there. This is the... Now, blood flow through the heart starts at the superior vena cava, the inferior vena cava, and the coronary sinus. Flows into the right atrium, which flows through the tricuspid valve into the right ventricle. Is pumped up to the pulmonary semilunar valve, through the pulmonary trunk, into the right and left pulmonary arteries, out into the lungs on either side to be oxygenated. From there, the blood comes back through the right. From there, the blood comes back through the right and left pulmonary veins, through the left atrium, passes through the bicuspid or mitral valve into the left ventricle, and is then pumped up into the aortic semilunar valve, which comes up to the ascending aorta, through the aorta, and goes to either the heart or the body to be used or reoxygenated. That is the blood flow through the heart.
Coronary circulation is circulation of blood in the blood vessels of the heart. Vessels that deliver oxygen-rich blood are coronary arteries. In this image, the lighter tinted vessels are more posterior. The arteries include the left coronary artery, which feeds the left side of the heart and branches and forms the anterior interventricular artery, also known as LAD, which supplies anterior walls, both ventricles, and the atrioventricular septum. The circumflex artery, which supplies the left atrium and the posterior left ventricle. And then you also have the right coronary artery, which feeds the right side of the heart. This is formed by the marginal artery, which feeds the lateral right side of the heart, and the posterior interventricular artery, which feeds the remaining part of the posterior ventricles. The anterior interventricular artery and the posterior interventricular artery meet at the apex of the heart, which is called anastomosis. Collateral circulation means additional routes of travel for blood to get to the same place. Vessels which remove deoxygenated blood are called veins. In this image, the lighter tinted vessels are more posterior. There is the great cardiac vein, which drains the anterior interventricular septum, the middle cardiac vein, which drains the anterior interventricular septum, the small cardiac vein, which drains the right inferior margin of the heart and the lower right side of the heart, You also have the coronary sinus, which is composed of the great, middle, and small cardiac veins, and the anterior cardiac veins, which drain the right side of the heart. Clinical problems regarding coronary circulation include angina pectoris, which is disruptive blood flow to the myocardium, as well as myocardial infarction, which is a heart attack. And the blood flow stops to an area of the heart, and that area of the heart dies. Cardiac muscle is striated and branched and uses sliding filament to contract. Cardiac muscle contains intercalated discs, which are made of desmosomes and gap junctions. Cardiac muscle requires 10 times more mitochondria than skeletal and uses aerobic respiration. Cardiac contraction is very similar to skeletal contraction in that it uses sodium and calcium and is a positive feedback loop. Some differences between skeletal muscle and cardiac muscle include the all or nothing rule, which the skeletal muscle does not follow, but the cardiac muscle does, meaning that either the entire heart contracts or not at all. Another difference is stimulation. Skeletal muscle uses neurons to stimulate it, whereas cardiac muscle is autorhythmic and depolarizes by itself. Another difference is the absolute refractory period. Skeletal muscle has a 1 to 2 millisecond refractory period, whereas cardiac muscle has a 250 millisecond refractory period. The heart has a longer period, so it doesn't lock up, which is called tetanus. Clinical problems of the heart include tachycardia, which is a heart rate higher than 100 beats per minute, bradycardia, which is a heartbeat below 60, atherosclerosis, which is clogged arteries, and congenital heart failure, which is when the heart can't pump enough blood to keep up with the body's demands. If the left side fails, it's pulmonary congestion, and if the right side fails, it's peripheral congestion. Congenital heart failures. Cyanotic means blue. Tetralogy of Fallot is 4 defects, and it has a hard time pumping oxygen. There's also transposition of great vessels, which means that the heart is backwards and the aorta is on the right side and the pulmonary is on the left. Acyanotic includes atrial septal defect, which is a hole between the atria and the blood mixes in. There's ventricular septal defect, which is a hole between ventricles, and aortic stenosis, which is a narrowing of the aorta, and pulmonary stenosis, which is a narrowing of the pulmonary trunk.
From there, the blood comes back through the right and left pulmonary veins, through the left atrium, passes through the bicuspid or mitral valve into the left ventricle, and is then pumped up into the aortic semilunar valve, which comes up to the ascending aorta, through the aorta, and goes to either the heart or the body to be used or reoxygenated. That is the blood flow through the heart.